Hello, Professor. Today I'm going to introduce you a protocol that I invented by myself. And it's really easy and simple. So when I introduce it to my workers, I believe they will understand really quick. So this will also help me to train my workers and to them to understand how to create a clean environment and safe environment, not only for themselves, but also for the patients. So before going to the details about disinfection, sterilization, and cleaning, I want to talk about the standard clothing, which are protective glasses, mask, gloves, and shoes that are required. These 4 things are required for the dentists and assistants. And as for the administrations and the cleaners, I will ask them to wear masks and shoes. Here I mark a triangle mark on the gloves because for the administrations, they can wear the gloves if they want, but I would rather to provide them a box of alcohol wipe or a bottle of alcohol while they are receiving patients, and if they have the need to clean their computers or keyboards or tables or shelves when they have the need. And for the cleaners, it is absolutely necessary for them to wear gloves while they're cleaning because I don't want them to get any irritants from the chemical disinfectants, and I also don't want them to exposed to any potential of contamination from the fluids or blood or saliva that is left by the patient at any possible area. So after this brief introduction about proper wearing, I would like to go into the important things that I'm going to talk about today, which is disinfection, sterilization, and cleaning. So here I make a simple graph, which I divided into 4 different stages, which represents a different timing of opening and closing of the clinic. And then at the right hand side of the graph, I have marking into different colors, which represents the things that the cleaner and dentist should do. So here under the graph, I already divided into 4 different areas. And then beneath these areas, you can see that there are basically repeating things for these people to do. So for example, for the cleaners, the things they have to do is cleaning and storaging. For the dentists and assistants, it's their job to make sure that all the instruments are already disinfected and sterilized before the patient comes into the clinic. And it's also their responsibility to make sure that all the instruments are already collected and sent into the process of disinfection and sterilization after the clinic is closed. On the graph, you can see that I have also marked alcohol and chlorine during the daytime and evening time because alcohol is the material that I want to provide to the administrations. For the chlorine is the material that I'm going to provide it for the dentist so they can use this material while they're performing endodontic treatments. So these are the stages that I organized for these people. And then now I'm going to go into the details about what are the disinfectants that these people need at their working procedure. So about the cleaning stages, the cleaners will need chlorine and hydrogen peroxide because chlorine is going to be needed while the cleaners need to clean a wide space of area, such as floors, mopping floors, or cleaning windows, or tall shelves, or any other areas. But we know that metal material is going to get corrosive when they have exposed to chlorine in a long time. So they have another alternative choice, which is hydrogen peroxide. And then while these cleaners have finished their cleaning procedure, we have to ask the cleaner to make sure that these disinfectants are in the proper storage because we want to make sure that these materials can sustain their effectiveness. So we know that hydrogen peroxide is more stable in the dark container. So we should make sure that cleaner to see if these disinfectants are well stored in these containers. And also, since the alcohol is a flammable and easy evaporated material, we have to ask the cleaner to make sure that alcohol containers, the containers that have contained alcohol, is well sealed, and also is kept in a cool and well ventilated area. And then for the instruments, the dentist have to make sure that when the patient have visited the clinic, the assistants have take out the instruments from the sterilization room every time, which means that these instruments have well sterilized and disinfected. When they open the instruments and they have found out that these instruments have it's not in a well disinfected it's not in a well sterilization state, unfortunately, they have to indicate the assistant to take out a new set of instrument immediately. And then after when the patient has finished each treatment, it is important to ask the assistant to wipe the dental chairs, lamps, and sink with the hydrogen peroxide, because we want to decrease the cross-contamination from previous patient to the other patient. And then when the clinic is closed, as I have mentioned, that the assistant and the dentist has to collect that all the instruments that the patients have that they have been performed on the patients. As we know that if there is any organic materials on the instrument surface, it will decrease the effectiveness of the disinfection and sterilization. So they should wash them to remove all the organic or visible materials, and then use the alcohol wipe to remove to dry it, or remove any potential invisible materials. And then, depending on the materials, we will send it into disinfection and sterilization process. For the materials that are non-critical, we will send it into disinfection process, such as face bowl or mixing bowl. And then with these products, we will use glutathione to disinfect them. And for the sterilization process, at this process, the semi-critical and critical instruments are going to be sent into the sterilization process. And under the sterilization system, I'm going to use autoclave steam sterilization system, because autoclave is non-toxic and fast, and it will kill microbes and spores. And also it's going to penetrate fabric, so it's pretty convenient for me. And if these items are sent into the autoclave, I'm going to use a gravity displacement autoclave, which is going to be adjusted into 121 degrees and sterilized into 30 minutes. So above all are the steps and the disinfectants I'm going to use, and the things that the cleaners or assistants should be careful and watch out. Now I'm going to talk about the products that I'm going to buy it from. So for the chlorine hydrogen peroxide, which is used for cleaning the floors or wiping the dental chairs, lamps, and sinks, I'm going to buy it from Clorox. And then for the alcohol, which is going to be used by the administrations, I'm going to buy from Cleanel. And for the glutathione, which is going to be used as disinfectant instruments, I'm going to buy it from McKesson. So this is my project about the protocol that I made, and thank you